Good morning to all of you. Within 2-3 minutes, we have to start the session, next session, drug interactions. Only 21 are enter till type. आवाज येतोय माझा?
Yes, sir.
ठीक है. Within 2 minutes, we have to start the next session of adverse drug reaction. Total 44 enroll today's session. Right now we have to continue the today's sessions, that is drug interactions, various forms of drug interactions like drug-drug and drug-food interactions was observed during the medicaments taken by the human beings. Nothing but some reactions are beneficial, some are undesirables to our body. Screen is there? Screen is visible? My screen is visible?
sir.
ठीक है. Now we have to continue with the next part of adverse drug reaction of first unit, that is drug interactions. You have to see the figures like drug-drug interactions or overdose of the drugs, different drugs at a time. Drug interaction, nothing but there is interactions between pharmacological activity of one drug is altered by the another drug using of another drugs or presence of some other substances, like generally we have to take on the foods, milk, tea, coffee. These are the substances which alter the pharmacological action of concerned drug. That interactions are called as drug interaction. In simple words, drug, whatever the action of drug was altered by any reasons, that alteration of the response of concerned drug are called as drug interactions, either with drug or other substances which alters or enhances. Maybe the interaction may after interactions the action of particular drugs may be enhanced or retarded or give the adverse reactions also. The drug whose activity is affected by such interactions are called as object drug. जो पर्टिक्युलर ड्रग आहे ह्या इंटरॅक्शन मुळे त्याची ऍक्टिव्हिटी इफेक्ट होते, that drug is called as object drugs, and the agent which precipitate such interactions is called as precipitant. ये पर्टिक्युलर ड्रग ची जर ऍक्शनला इंटरफेअर करत असेल, precipitate करत असेल, that agents are called as precipitant in terms of drug-drug interaction or drug interactions. Object drugs, where particular drugs gives the pharmacological activity, that drugs are called as object drug. And precipitant by interfering with other materials. That materials are called as precipitate in drug interactions. If you see here, one tablet, one capsule. This is a drug interactions. Here another figure is capsule with citrus fruit. That is food plus drug interactions in the figures. They are categorized either drug interactions. Some are beneficial on the basis of their beneficial or undesirable effect. They are first classified as a consequence wise, that is beneficial drug interaction. Again, these consequence wise drug interactions are classified into two segments: beneficial drug interactions and adverse drug interactions, or you have to call it as undesirable drug interactions. Second class of the drug interaction is site wise. Which type of sites? Either internal or externals. Internal means when drug enter into our body, whatever the effects or whatever the interactions it occurs, that is called internal site of drug interactions. And external means whatever the dosage forms available in the market by externally before administration of drug to the human beings, whatever the changes, whatever the precipitations, whatever the actions occur with the drugs, that is measured in the external sites. Site-wise, these are the two classes, internal as well as external sites. And the third category is mechanism-wise drug interactions. After taking, there are two types of mechanisms: pharmacokinetic mechanisms and pharmacodynamic mechanism of drug-drug interactions. After taking the drugs, what will happen with the drugs and what will happen with the body? What will happen with the drugs? That is called as pharmacokinetic actions after absorptions. Which type of drug interaction is happens? First is pharmacokinetic drug interaction. They further classify on the basis of their pharmacokinetics. First is absorption interactions after drug entry into our body, particular drug undergo absorptions. What are the effects of concerned drugs? Distribution, proper distribution occur or not. Metabolism and excretions. What effect on excretion of particular drug-drug interactions? And second mechanism drug interaction is pharmacodynamic drug interaction. Pharmacodynamic, again they are classified what are the effect of drug on body. We have to study the pharmacodynamic drug interaction. These are the classifications. We have to detail study with the all class of drug interaction. First, consequence wise classification of drug interactions. Firstly, first interaction is beneficial interactions. All of you know, name itself indicate that this type of interaction is benefit to cure the treatment, cure the treatment from the particular disease. There is a minimized risks with these beneficial interactions to and improve the therapeutic efficacy of the drugs. Some examples of beneficial interactions. Last year you have to study in medicinal chemistry third, sulfonamide. The combination of sulfamethoxazole and trimethoprene, that is clotrimazole. This combination is beneficial to give the better antibacterial effect. Both the drugs giving their desirable effect in inhibition of folic acid synthesis in particular bacteria. Sulfonamide inhibit the incorporation of PABA, whereas trimethoprim act in the next stage of the folic acids. This combination is beneficial to the patient and improve their efficacy, therapeutic efficacy, and that is free from the any diseases. Another example, enhancement of the activity of penicillin when administered with the robin seeds. Robin seed is a prodrugs. These products when enter into our body, they give the enhances the activity of penicillin. Penicillin act as a antibiotic. Similarly, another examples of different hypotensive drugs, beta receptor blockings and diuretics, gives the additive effect. Generally, beneficial interaction nothing but it's an addition or improving the particular drug response. That is called as beneficial interaction. These are some examples related with the beneficial interactions. The easy examples are still the understand kara, remember kara. In these topics, maximums are the examples. With the help of examples, you have to give your statements as per the wordings in adverse drug reactions also or in drug interactions also. Second is in a consequence-wise drug interaction. Second is adverse drug reactions. Already you have to heard the name adverse. Adverse means unwanted. Generally, one drug, they react with another drug, they antagonize the effect of other drugs. They act oppositely to each others. That is gives the adverse drug interactions. For example, in this category, morphine and noralphins, they give the opposite physiological actions. Similarly, another example, chorinesterase inhibitors and atropines. They give the opposite actions. Opposite actions झाल्या म्हणजे काय झालं? Every actions, opposite action gives zero reaction. The output of that type of reaction is zero. There is a non-beneficial interactions. So this type of interactions generally avoided by the physicians or take the necessary precautions while prescribing the particular medicaments in concerned diseases. So those are the beneficial interactions. Generally, continue that type of interaction by the physicians, but they aware about the adverse reactions concerned with the particular drugs. So to avoid that type of reactions, generally physicians avoid such a combinations during its prescriptions, which is harmful to the patients. So generally this adverse drug interaction generally avoided by the prescriptions or physicians. Second classification of drug interaction is on the basis of site-wise drug interactions. Site means either internal or external site. External means outside the body, when particular medicaments enter into our body before there is some changes in the drug. There is due to the chemical incompatibility or dosage form. Due to the dosage form, there is a changes occurs during the administration or given to the particular patients. Before given to the patients, whatever the changes, that changes are called as externals, either physical or chemical changes. For examples, when rabiprazole introduced in the market, they kept in a cold chain storage condition externally before administrations. If temperature is increases, there is a changes chemically and formation of white color, rabiprazole convert into blackish color in the vials also before taken if temperature is increases enough. So during transportation or handling of the rabiprazoles, and enter into the market, they kept in between 2 to 8 degree. And during transportation to the wholesalers or as well as the retailers, the maintaining the temperatures also for particular injections. That type of medicaments or that type of changes due to the storage conditions or chemical property of concerned drugs, they are observed externally. There is an interaction between particular drugs. We have to cover here, either due to their physical changes or chemical changes. Sometimes when they mix with some medicament with the IV fluid, there is a changes in the precipitations or some precipitation occur in the IV fluids. That type of interactions generally avoided or notified to the concerned physicians or concerned doctor or nursing staff which is available in the wards. If particular drug or medicament enter into the IV fluid sets, there is some precipitation occurs, they observe and immediately intimate to the concerned physicians. Why intimated? The unwanted effect, avoiding of the unwanted effect after entering into the particular patients. बरोबर आहे? Changes झालेला drug, there is a poisonous to our body. So that type of drug interaction externally before administration to the particular patients, whatever the changes, generally avoid during the treatment. For example, in the external site drug interaction, the first example is co-administration of penicillin tetracyclines, penicillins and tetracyclines. There is formation of precipitations in IV fluids. If penicillins and tetracyclines, they are administered simultaneously, there is a precipitation occur in the IV fluids. True, for such a conditions, these drugs are avoided at a time. At a time mixing in the IV fluid are avoided. After one antibiotic enter in our body, they'll give the second ones. Simultaneously, generally these penicillin and tetracyclines are avoided because of there is a precipitation occurring in the IV fluids by combining with this penicillin and tetracyclines. Another example in external category, penicillins cause the inactivation of gentamicin if given together in IV fluids. If penicillin and gentamicin given through IV fluids, gentamicin are inactivated by penicillin. So this type of drug is unwanted to our body. So generally advised by the physicians taking care by administration with this such a kind of precipitations occurring drugs. These are some examples of external site-wise drug interactions. Next, opposite to external, internal. When particular drug enter inside our body, what are the changes? Observe during the interactions. Maybe adverse or maybe beneficial. Some interactions carried out in GI tract or livers, or some drug gives their action at particular sites. For example, cell membranes, receptor sites. These are the interactions occur inside our body with drugs. There is one example related with this internal site-wise drug interactions. There is atropine competitively blocks pilocarpine action at muscarinic receptors. The atropines given and pilocarpine also given, they competitively block the muscarinic effector receptors. These are some examples, simple examples with site-wise drug interactions, internal as well as external. Third category of drug interaction classification is classification on the basis of mechanism action, mechanism wise drug interactions. Mechanism, which type of mechanisms? There are two types of mechanisms which can interactions develop. Either first is pharmacokinetic interactions. This is the first mechanism when drug enter into our body. Second is and drug how drug act, that is pharmacokinetic interactions, and how body interact to the drug. You have to observe in
हाँ हाँ झोपला
pharmacodynamic
उधर है उशिरा
interaction.
झोपला रे
कशाला झोपायचं उशिरा? हं? कोण झोपले उशिरा? These are the two mechanisms while observe their interactions. One is pharmacokinetics and pharmacodynamics. How drug involve their action into the body and how body responds to the particular drugs. In pharmacokinetics, there are again four types of interaction. First is absorption. Just सांगायची गरज पडणार नाही. Already you have to study in pharmacology as well as in biopharmaceutics, as well as in sometimes you have to observe in the metabolism in medicinal chemistry. Here, absorption, already we have to discuss about the object drugs. Object drug are those drugs gives the pharmacological response. Whatever the alteration of that particular response of concerned drug due to the absorption of object drugs, that interactions are called as absorption interactions. The net effect of such interaction is either faster or slower the drug absorption, more or less complete drug absorptions. These are the net effect of absorption interaction. Either when drug enter into a body, their absorption is either fast or slow, depend on their natures of drug. Or there is a complete absorption or incomplete absorption of particular drug when enter into our body. There are some major mechanism. There are 7 types of mechanism of absorption interactions. First is complexation and absorption. Particular drugs, they compile and formation of complexations and further absorption. Alteration in gastrointestinal pH, they also affect in the
और नहीं क्यों
absorption.
किरण लेड़ा भोगा था इधर देखिए देखो पर है पहले को पर है
Third mechanism of action is alteration in gut motility.
मैं को आंगुल करा बोल थी तिकडे
Inhibition in the gastrointestinal enzymes. Alteration of gastrointestinal microflora. These are the mechanisms of absorption interactions. Sixth is malabsorption syndrome. These are the mechanisms of major mechanisms of absorption interaction. First is complexations and absorptions, alteration in GI pH, GI motility, GI flora, GI enzymes, and malabsorption syndromes. These are the major mechanisms where drugs are undergo absorption interactions. We have to see clear about this ADME characters interactions. That is pharmacokinetic interactions. That is ADME interactions. These interactions are those in which ADME properties of the drugs is altered by the precipitats, and hence this interaction is called as ADME interactions. The resultant effect is altered plasma concentrations. If absorption is retarded of particular object drugs, then plasma concentrations get affected by the drugs. They are further classified. Absorption, in distribution, metabolism, and excretions. After mechanism of absorption interactions, there are some examples in this category, absorption interaction category. Through first their mechanisms, complexation and absorptions. These are the object drugs, precipitate drugs, and their overall influence on object drugs or main drugs. What are the influences occurs in absorptions? In the precipitant drugs, either other drugs or foods may hamper or enhances the absorption of object drugs. These are the examples. First example, first mechanism of absorption interaction is complexations and absorptions. For example, ciprofloxacin and or penicillin. These are the object drugs. Then when these object drugs enter along with these antacids or some food or nutritional materials contain nutrition supplements containing aluminum, magnesium, calcium, zinc, ions. When these drugs, ciprofloxacin and penicillin, given along with these precipitant drugs, they give the poorly soluble formation of poorly soluble absorption of particular drug, or maybe an absorption complex formation with metal ions. So during this ciprofloxacin or penicillins, to avoid this complexation, to avoid the metal ions containing food material as well as antacids, avoided for better absorptions and avoid the complexations. Second mechanism of interactions of absorption is alteration in gastrointestinal pH. Here, the example is sulfonamides, aspirin, ferrous sulfates. They given along with antacids. Here, sulfonamide, aspirin, and phosphorus sulfate. They given with antacids. They enhances dissolution and absorption rate. Sometimes it is beneficial, sometimes it is undesirables. If the drugs given with the antacid, they enhances the dissolution and absorption rate of sulfonamide, aspirin, and ferrous sulfate. If these drugs given with sodium bicarbonate and calcium carbonate, there is a decrease in the dissolution and absorption rate. Here antacids are the free from sodium bicarbonate and calcium carbonates. Antacid like H2 blockers, PPS. You have to give one with sulfonamide, they enhances their absorption rate. Whereas with the given with the ENO, for example, ENO with sulfonamide and aspirins, they decrease the absorption and dissolution rate of this drug absorption. Screen दिसते Okay, last 10 minutes remains with this today's session. Third mechanism action of absorption interaction is a alteration of GI gut motility. Here example, aspirin, diazepam, levodopa, maxilidine. They given with the precipitant drug, that is metoclopramides. When these drugs are given with the metoclopramide, they give their rapid gastric empty. The effect is on object drug is rapid gastric empty and increase the rate of absorption. If this aspirin, diazepam, levodopa when combined given with the metoclopramide. They enhances the gastric emptying time as well as increase the rate of absorption of object drug. Levodopa, second example in alteration of gut motility. Levodopa, lithium carbamide, mixility, given with the precipitant drug, anticholinergics, if given with anticholinergics, the action on object drug, these drugs, levodopa, lithium carbonate, and mexilitine, the observed action is delayed gastric emptying times and decrease the rate of absorption of these drugs, object drugs. That is levodopa, lithium and lithium carbamate and mexilitines. Another mechanism actions of absorption interactions are alteration in the GI microflora. The drugs, object drug, for example, in this type of mechanism of absorption interactions, digoxins, they generally given with the antibiotics, there is increase the viability of digoxin due to destruction of bacterial flora that inactivate digoxin in lower intestines. When this digoxin object drugs, they react with the participant drugs, antibiotics. With the help of antibiotics, increase the viability. But how the viability increases due to destruction of the bacterial flora which is present in the lower intestine, which may inactive the digoxins. That's why the antibiotics are given with the digoxin to give the better viability. And last mechanism in absorption interaction, that is malabsorption syndromes. When vitamins A, vitamin B12, digoxins given with the neomycins, there is an inhibition of the absorptions due to malabsorption syndromes. When this neomycins inhibition the absorption. These are the absorption interactions. It is one of the class of pharmacokinetic ADME interactions. जेवढं बघू second interactions in pharmacokinetics, that is distribution interactions. Distribution means particular drug reach to the particular sites through कसं through protein drug bindings. These reactions is maybe this type of interaction may be alter the action of drug by protein drug bindings. The major mechanism of distribution interaction is protein drug interactions. This is one examples with distribution interactions. Competitive displacement interactions. When anticoagulant object drug, they react with the precipitant drug, phenyl butazones or chlorohydrate, there is an increase the clotting times. Generally, anticoagulant are given to avoid the coagulation of blood. And the influence on the object drugs increase the clotting time of blood, increase the risk of hemorrhage if anticoagulant react with the phenyl butazones or chlorohydrate. They competitively displace the reaction of object drug, here anticoagulant. Another examples of these distribution interactions is tolbutamides. The tolbutamides given with the sulfonamide, they increase the hypoglycemic effect. The competitive displacement by sulfonamide to the tolbutamide drug, that is object drug. Due to competitively displacement of these tolbutamides, there is a increase the effect of hypoglycemic effect on body, our body. So this is the distribution interactions. Generally protein drug binding effect we have to observe here. Generally competitive displacement interaction we have to observe here in distribution interactions. So today this part is over up to distribution interaction. Next lectures we have to go with the metabolism interactions, excretion interactions, and pharmacodynamic interaction in drug interaction category. And for finally, detection, some detection methods of ADS we have to discuss here in next lectures. And this video of today's lectures, we have to see in up to 10 to 15 minutes in the Google Classroom. Those are not enroll your pharmacy practice Google Classroom. Those are not up to today. Those are not enrolled to the particular classrooms. You have to join it, remaining student. Total 71 students joined till date to the Google Classrooms. Whatever the lectures conducted through Zoom platforms uploaded in the Google Classrooms. Also, the assignment parts. If assignment PDF uploaded, then okay through this platform, Google Classrooms, or within within 4 or 5 days, we Medalabs logins provided through we VM Medalab software agencies to you after getting the admission in final years. Final year admission घेतले का तुम्ही? का नाही अजून? घेतलं नसेल तर ऑनलाईन प्रोसेस विचारा ऑफिसमध्ये आणि त्यानुसार प्रोसीड करा. ठीक आहे. So today's session is over here. So now end the today's sessions and continue with the today's ceremony and visurgin at your or individual home. Thank you.